Hi everyone, welcome to Evolve 101 Health Talks with Dr. Inaka Yembe. In these videos, I share with you information on medical problems that you can use to help yourself at home. In this series, we are talking about diabetes, and this is video number 4 of a 5-part series. In the first video, we talked about the definition of diabetes and the risk factors. In the second video, we talked about the symptoms and how your doctor diagnoses you with diabetes. In the third video, we talked about the treatment and how you can manage your diabetes at home. And in this video today, we are talking about complications of diabetes. The hallmark or the distinguishing factor of this disease is elevated blood sugars. So when your blood sugars are elevated and it circulates through your body, it causes major problems which we can divide into two main groups. Macrovascular, those are the ones that affect the bigger blood vessels, so in your brain, your heart, and your legs. And microvascular, and so those are complications from diabetes that show up as eye problems, kidney problems, problems with your nerves, for example. So the major complications of diabetes are as follows. Number one, heart disease. Diabetes is a major risk factor for heart disease. Now, if you have diabetes and you have high blood pressure, those are compounding risk factors. If your blood cholesterol is high, your blood pressure is high, and you smoke and you have diabetes and you are overweight, you are a major ticking time bomb. You have a high risk of having a heart attack or a stroke. So it is very important for you to work very hard on controlling your blood sugars at home. And how do we do that? I keep repeating it. We need to try to cut back on starches, become more active by exercising, stop smoking, stop drinking alcohol, reduce your weight. All these things will help reduce your risk factor of developing complications from diabetes. So again, the first complication is heart disease. Diabetes is a silent killer. Some people who have heart attacks don't even have chest pain or don't even have shortness of breath. But what we know is if you are diabetic for several years, especially if you're not taking your medicines like you're supposed to, or if you're not watching your diet, then your blood sugars can stay high and they just put you at risk factor of developing blockages in your heart and blockages in the blood vessels that go through your heart and through your brain and through your legs, and these cause heart attacks, stroke. They cause you to have vascular disease, so disease of the blood vessels of the legs. How do you know you have problems in your legs? You have numbness in your legs, for example. You start to have sores. You have wounds that don't get well. Sometimes you have what we call pressure ulcers. Let's say you wear shoes or you have something that causes a cut. Then you have a wound that doesn't heal, or you wear shoes that are too tight and they can rub on one area and cause pressure. And actually that area can break down and become a wound. That may take a long time to heal. Very important. So if you are diabetic, you want to again try to reduce your blood sugars, excuse me, by controlling your diet, cutting back on starches, becoming active, walking, drinking lots of water, and avoiding sugary drinks, alcohol, and stop smoking. Very important. Diabetes can also affect the eyes. It can cause blindness. It can cause kidney problems and can actually lead to kidney failure and dialysis. Diabetes can affect the nerves in your hands and in your feet and in your stomach, so you just tend to have numbness and burning and tingling and pain in your feet, your toes, and your hands all the time. That is a symptom of high blood sugar that has been high and uncontrolled for too long. So it's very important for you to control your blood sugars. Again, most people who have diabetes and even complications from diabetes do not have any symptoms. So what do you do on your part now to prevent these complications? Number one, follow the diet. Again, cut back on sugary foods and drinks and cut back on starches like we talked about in the last video. Number two, take your medicines as directed, as instructed. If your doctor gave you tablets or capsules, take them. If they gave you injections, take them. It's important for you to take all medicines as prescribed. Very important. The third thing that we need to do is just to keep up with our checkups. If your doctor says, come in a month, go back in a month so that your doctor can take a look at you and make sure everything is okay. Sometimes they may repeat tests and sometimes they may not. Now, a few things that are important for you to get checked if you can. Number one, because diabetes will affect your eyes, it's important that you get your eyes checked once a year. Even if you don't have problems with your vision, even if you don't have blurry vision or double vision, diabetes is a silent killer, meaning that most of these complications we've talked about, we don't feel any problems. We think we are fine until all of a sudden something major happens, like we go blind or we have a heart attack or a stroke. What we know for sure in medicine is that when your blood sugars are well controlled, meaning that you stick your finger and you can check your blood sugar. If you don't have a way to check it at home by yourself, then go somewhere where you can get it checked. And in the morning before you eat anything, that number should be between 80 and 100 fasting, unless your doctor tells you otherwise. Now, if it's after you've eaten, try to wait at least 2 hours. After 2 hours, your blood sugars should be less than 180. But it is by checking your blood sugars at home frequently that you can keep a check on your own diabetes before you go back to your doctor's office. Now, let's say you check your blood sugars at home and your blood sugars are 300, 400, 500. What can you do? Number one, be thinking about going back to your doctor or to the hospital quickly, especially if your blood sugars are above 400. Go in and get it checked. If you can absolutely not get to the doctor's office or to the hospital, drink lots of water and stop eating starches. Those starches get us in trouble. Fufu corn, potatoes, rice, cocoa yams, fufu yam, cassava, bobolo, achu, all those things are very high in carbohydrate. If your blood sugar is high, it will only make your blood sugar higher if you eat these starchy foods. In addition to that, the things we drink, like we talked about, are very important. So you also want to cut back on drinks that have sugar. For example, anything like Sprite, Coke, pamplemousse, juice is very, very important. If your blood sugar is high, it's important for you to stop drinking juice. If you are in the hospital, I see this all the time. When you are in the hospital, family members bring juice as a healthy option for something for you to drink. No, juices have a lot of sugar. So if somebody is in the hospital for diabetes and their blood sugar was high, just bring them water. Clean water that is bottled. If it is not bottled, boil it at home before you bring it to the hospital. So those are the complications of diabetes. Again, diabetes is a silent killer. Most of the time you don't feel the symptoms. Diabetes can cause sudden death because it causes heart problems. It is a risk factor for heart problems. So if your diabetes is not controlled, you are at risk of having a heart attack now. And most diabetics can actually be having a heart attack without feeling any pain. but you feel other symptoms like shortness of breath sometimes. For women, we just feel bad. Something just overcame us and we cannot describe it. What we know is that when you feel very bad, something is wrong. So we women have to learn just not to blow off our symptoms and say, oh, well, I have to go and work my farm. Oh, I have to go and do all these other things. Oh, I have to go and take care of my children. When we know we feel bad, especially if we are diabetics, if we feel bad, first thing, check your blood sugar. If you don't have a way to check your blood sugar when you're feeling bad, it's important that you go somewhere quickly to check it. I want to end by talking about time. Time factor for women, especially those of us who are women. We are caregivers, we have a farm to work, we have these babies to feed, we have to take care of the family, we are constantly thinking about other people, and we put ourselves last. What we also know in medicine is that women have symptoms that are not specific, meaning that you have symptoms or sensations or feelings of very serious diseases that are not classic. So for example, if a woman is having a heart attack, she may not feel pain at all. She may feel her heart racing. She may have weakness. She may feel just very, very tired. She may feel like she cannot breathe. Those are very important symptoms, and I encourage you, don't go home and sit down and wait for it to pass. Even if it passes, fact is that you may have already had some damage, and that damage will just continue to add up, and what happens after that is sudden death. Diabetes can cause sudden death by causing damage inside of your body for long, and when it has gone far enough, then your body just gives up like you have a major heart attack. Please, women, let's remember not to ignore or postpone symptoms that are serious. Serious symptoms are, of course, if you have chest pain, very important, you go to the hospital. If you have difficulty breathing, you have trouble breathing, don't wait, go to the hospital. It's always better for you to go to the hospital when you have a serious symptom than staying at home, waiting and hoping for it to pass, and then something bad happens. If you have weakness on one side of your body compared to the other, that could be a sign of a stroke. If you have weakness of your face, on one side of you try to speak, your tongue is heavy, your mouth is heavy, your face is crooked, your arm is weak, your leg is weak, your eye is closed now, you cannot open it, something is drawing your face to one side because the other side is completely weak. These are signs and symptoms of a stroke. Those kind of symptoms do not get well on their own. So all of a sudden, you may wait, and then something catastrophic happens like death. Diabetes is a risk factor for major medical problems like I have said, heart attack, strokes, kidney problems, eye problems, problems with your stomach, problems with numbness and pain and feeling like pins and needles walking up and down your fingers. So if you're diabetic and you start having those symptoms, it is important for you to check your blood sugars. Do everything you can to get those blood sugars checked, because your blood sugar may be high and your doctor may need to adjust your medicines because of that. So I hope that information helped you. This is video number 4. In the next video, I will answer all the questions that I received based on the information that I've shared with you when it comes to diabetes. If you missed the first 4 videos, please go to the chat box below and I would put links to the previous videos so you can watch those as well. Again, if you have not subscribed to my YouTube channel, please go ahead and subscribe and then hit that notification button so that whenever I put a video out like this, you get notified and you can receive the information. I hope this information helps you. Thank you.